Hi, welcome to this week's episode of Ask Dr. Jessica. I'm really excited for this week because we're going to have a special episode talking about children and their attention with my youngest sister, Marissa Leitner, who is also a school psychologist. So my first question for you, Marissa Leitner, how do you know what is normal? A lot of parents will be concerned that their 2-year-old can't sit still in a restaurant, for example, and I can reassure them that 2-year-olds aren't expected yet to sit still in restaurants, and that is normal. But how do you gauge when it is abnormal or when children might need more help?
For kids between the ages of 3 and 5, there's just a wide range of where they are in terms of their focus. When kids get to be around 8 or in 3rd grade, 8 or 9, that's when I would really pay attention to how the student is doing and are they able to learn independently. That's an age where students are no longer learning how to read, but they're reading to learn, and where students need to be independent and start understanding the material independently and accessing the curriculum. And so that's when teachers and parents might notice that there's something that might not be considered typical.
Okay, so let's say a parent has a 3rd grader and they notice that their child may have difficulty sustaining attention in school. What can you as a school psychologist do to support the child?
That's a great question. So at that time, I would bring together the teachers and the parents for a meeting potentially, and to talk about what's going on. So from the parent, for example, I might interview and find out what is going on at home. Is the child sleeping enough? Is this something new? Are their parents fighting? How is the child eating habits? Is there anything new happening at home? So that's the home side. And sometimes the home side can affect what's happening at school. And then at school, I work with the teachers. I look at report cards, observe the child in class during different settings. Is this happening just in math, or is this also happening in reading as well? I look how the student is behaving with their peers and interview the teacher. And at that time, we can come together and find out, are there any interventions we can do to help support the child, both at home and at school?
That's really interesting. So it sounds like as a school psychologist, you're basically the bridge between the teachers and the parents.
We work together, and the more parents and teachers and administration and the school psychologists can work together, the best for the child, because everyone's on the same page and we're working with the same expectations and looking to help the child improve.
So as a school psychologist, how can you best support the teacher as it pertains to the child in the classroom? Do you have any common tips that you give to teachers to help a child?
So every child is different, but some common recommendations might be preferential seating, whether that be having the student sit up close to the teacher, or maybe in the back where they can stand and kind of walk around to get their wiggles out, or sit next to a positive peer role model.
Like the teacher's pet?
Maybe. Or...
That would have been you.
Right, I was going to say you. Or movement breaks. And the whole class can benefit from these movement breaks where they do jumping jacks, or this particular student may take a note to the office or, go get a drink of water. So those movement breaks. And then praise. When children are acting out, they don't want to stand out, and they don't want to be the one who's not paying attention or impulsive. So I would praise as much as possible for every success. So for example, if a child is blurting out, rather than saying, okay, you need to raise your hand, every time the child does raise their hand, then you would say, thank you for raising your hand, and maybe give them a check mark. And a certain number of check marks leads to extra break or something like that.
So I like that. It sounds like your strategy is more to give them positive attention for doing good things rather than focusing on disciplining them?
Exactly. Positive attention whenever possible and encouragement.
So now to segue from the last question, as a school psychologist, what are some common tips and advice that you offer to parents to help support the child?
So every house is different, and I would try to find out what's happening. I think some rule of thumb would be, make sure no one's hungry. It's hard to work on an empty stomach.
So true.
Is the child sleeping enough, consistent bedtime, even on the weekends, and getting enough sleep? I'd also make sure that the child isn't overscheduled. Sometimes you go from piano to soccer to dance, and that's a lot on kids. They need some downtime, so factor that in. I would look to make sure maybe your child actually needs a sport. They need an outlet for all of their energy, or maybe they need to do some workouts in the morning. And then in terms of when the child is actually working or doing homework or being asked to do some academic work. So I would find a designated area at the house, a quiet area, have it be consistent with the materials that are needed, and I would Set the expectations to where the child is at. If talk to the teacher. If your child is spending way too long on homework, what needs to be modified? Maybe your child should only do every other problem, or maybe they should work for 5 minutes and then take a break and then another 5 minutes. And maybe that's it. But I would just work with your teacher and find that happy medium so that your child doesn't feel frustrated and feels successful with what they're doing.
So this may be a tricky question to answer, but with screens so pervasive, the high-def TV, the really good video games that get kids really involved, how do we compete with that as parents? How do I get a child to be interested in their homework when there's screens to compete with?
It's very hard. I would say at a young age, it's a lot easier to just keep it off as much as possible for as long as possible. And then as kids get older, everything in moderation. And I would just make sure that when you do allow your child to watch screen time, make sure that it's quality and there's purpose. Did they earn it? Maybe they did their homework and then they get it as a reward. So just be mindful when you do let your child watch television.
I think these points that you make about making it quality and setting limits are really important so that a child's not just watching screens all day.
Right. So what I'm saying is don't watch as much TV as we did.
We did watch a lot of TV. Yeah. So I guess the big picture here is to have realistic goals, know that screens are part of our environment, but as best we can, set limits and make it purposeful and educational.
Right.
The New England Journal of Medicine did a study showing that children that entered kindergarten with August birthdays were more likely to get an ADHD diagnosis. A lot of parents will ask me about this. They'll ask me, do I think there's a benefit to holding their child back so they don't get a diagnosis? Do you find any validity to this comment or statement?
I would look at a lot of factors for that individual child. How are they doing socially with their peers and their friends? How is their emotional development? How are their pre-academic skills or their fine motor skills and their gross motor skills? Or how is their language ability? So I would look into all of those factors before making a decision and work with the preschool and the child care providers to help you determine that level.
Okay, so it sounds like it's more about the big picture, looking at the whole child to determine if it would be beneficial.
Right.
So let's say a child does get a diagnosis of ADHD. What can the parents then ask to the school to help their child?
So the parent can come to the school with this information and have a team meeting to talk about the next steps, whether that be the child would be assessed to see if they would qualify for an IEP or individualized education plan, or maybe the child would qualify for accommodations under a 504 plan. So that's a discussion to have with your school to see the next steps.
If a child gets diagnosed with ADHD, should parents worry a lot about their child's future, or is this something that they can manage as time goes on?
I would say early on, if you teach your child to manage skills such as time management, making checklists, having supplies ready, using time wisely, this can really be a superpower in the long run. And you can be very successful in your job because you can turn your attention to different items and get things done and be effective.
I think that's a really good point. I know that the CEO and creator of JetBlue, David Neeleman, credits his ADHD as his superpower, that he was able to create the company because of his ADHD.
So medication is a form of treatment for ADHD. As a pediatrician, what do you say to parents who come to you asking questions about medication management?
That's a great question. So my stance, I don't think every child has to be put on a medication if they're diagnosed with ADHD, but I do find that medications are often really helpful. My analogy is it can be like if a child has bad vision and then you give them glasses and all of a sudden they can see. I find that's a similar analogy when children have ADHD. Oftentimes they'll take medications and immediately their symptoms of being hyperactive or having trouble focusing are greatly improved. So while I don't think it's an absolute, I do think in a lot of circumstances it's helpful. And my goal as a pediatrician, I will place children on the lowest dose that can help them the most. So I'll often start with the lowest dose possible and then gradually increase until we see the biggest benefit in symptoms, and we'll go from there. Thank you so much, Marissa, for joining us today. How can people find you if they have any questions?
Please reach out to leitnereducation.com.
I'll put a link below. Thank you so much for listening to this week's episode of Ask Dr. Jessica.